Letitia.
Nick. Thad.
Sean.
Sammy.
Okay, today I'm going to inform you about post-op gallbladder surgery care. Many people elect to have gallbladder surgery, some related to gallstones, others because of diseased, unfunctioning gallbladders that cause pain and discomfort and can lead to serious infections if not dealt with. Dr. Ronald Hoffman, he's a gastroenterologist stated that 20 million people have gallbladder disease in the United States. Some may argue that the number of gallbladder surgeries performed are unnecessary, but if you're an individual who suffers from the discomforts of a gallbladder attack or painful gallstones, then you may elect to have this surgery as well. With so many individuals having this surgery, it is important to understand the post-operative side and what all it entails. Most individuals will not have any problems after gallbladder surgery. However, some people will have difficulties. According to an irritable bowel specialist, Barbara Bolin, 20% of individuals have ongoing abdominal pain and discomfort after gallbladder surgery. Along with this, there are long-term lifestyle changes that need to be addressed and learned when it comes to diet, and there are activity and wound care things that need to be addressed as well and learned. These things need to be well understood by the patient prior to having surgery, if it is successful outcomes are to ensue. The first step in recovery is knowing and understanding how to care for your wound. The laparoscopic surgery incisions are very small, about 1 inch usually, and you can have up to 3 of those usually. These incisions are often dermabonded. Dermabonded is a super glue type of adhesive that attaches the skin together so that sutures and staples are not necessary. If it is not necessary for bandages or ointment to be used with dermabond either. So caring for the incision after gallbladder surgery is simple. You can just shower with regular soap and water, dab dry. Things to remember though are that infection at the surgical site is always a concern. According to the American College of Surgeons, a patient should notify a surgeon if any of these symptoms occur. Fever of 101 or greater, pain that won't go away, foul-smelling drainage, vomiting, redness, and not having a bowel movement for 2 to 3 days is also a major concern. Despite the patient and the surgeon's best efforts, infections still occur. So reporting these symptoms as soon as possible is always very important. According to the Journal of Society of Laparoendoscopic Surgeons, wound-related symptoms are common after laparoscopic cholecystectomy. Follow-up appointments are important. Infections prolong return to work and cause a burden on the healthcare community. The second thing to be concerned with postoperatively is activity. What is a patient to do or not to do after surgery? Well, walking frequently and light activity is very important. These prevent blood clots from forming and also increase oxygenation, which enables better wound healing. It also helps to fully utilize the lungs. With those lungs being not used as heavily, when you walk and ambulate, you breathe deeper, which causes better capacity, and the diminished lung sounds and shortness of breath and clots do not occur. With laparoscopic surgery, the abdominal cavity is filled with a gas so that the surgeon can better see the gallbladder or other areas in order to remove them more easily. This light activity and walking also helps to expel that gas. It's also common, because of that gas, to have reverting pain up into the right shoulder. This is not uncommon, and ambulating helps to also alleviate those symptoms more rapidly. Lastly, and most importantly, for long-term care after the gallbladder removal is your diet. There are several blogs out there filled with patients complaining about post-op abdominal pain, discomfort after gallbladder surgery. Although most individuals have mild digestive issues, gallbladder surgeries, a percentage of individuals have more severe digestive issues. According to Dr. Peter Malamed, who is a Western medicine biotherapy specialist, 10 to 15% of people have problems after their gallbladder is removed. He calls this post-op post-cholecystectomy syndrome, which includes abdominal pain, either from nerve damage or other problems, diarrhea, and constipation. Most people feel that once their gallbladder is gone, all of the abdominal discomforts and pain that they felt prior will be fixed and that there will not be any more problems. However, it's important to maintain a diet that is low in fat and high in fiber. Fruits and veggies are a good choice, starting with a bland diet like rice, toast, bananas, and then working your way up to a more sustainable diet, allowing your body time and your digestive system to adjust to the gallbladder being gone. Because the gallbladder, its main function is to produce bile, which digests fats, once it's gone, the gallbladder can no longer function in this manner, so bile dumps directly into the intestines differently, and some fatty foods will cause immediate diarrhea or stomach discomfort and pain. It is important after gallbladder removal to try different foods gradually so that you know how your body will be affected by them. Many individuals suffer from abdominal pain, and they have several tests like ultrasounds or x-rays to try to find out why, only to find nothing visibly wrong. Well, one cause of this pain can be caused by sphincter of Oddi dysfunction. Sphincter of Oddi is a muscle valve between the bile duct, the pancreatic duct, and the duodenum in your small intestine. This valve, like any muscle, can spasm. This can't come up necessarily on an x-ray. It may show up on an MRI, but isn't very easily diagnosed usually. This leads to gastric juices not being eliminated properly, and severe abdominal pain can ensue. According to Dr. Malamed, 20% of individuals who have had their gallbladder removed have sphincter of Oddi dysfunction. Another common problem after cholecystectomy is dyspepsia, or indigestion, is what we call it. Although there are medications to help with that, the best thing to solve the problem of indigestion is eating small, frequent meals and avoiding high fatty foods. It's unrealistic to think that in this type of surgery is performed, everything will go back to perfect again, and that the pain will be completely resolved, because sometimes some of these post-operative symptoms can occur. If you choose to have gallbladder surgery because you suffer from painful gallbladder symptoms or disease, be aware that post-operative care that is necessary. Also remember, just because the gallbladder is gone doesn't mean the stomach discomfort will be eliminated. If abdominal pain and diarrhea become a problem for you, there are important diet regimens that can help and benefit and alleviate those symptoms some. By educating yourself, you can be better prepared to undergo the procedure and have the best possible outcomes. Thank you.